Welcome to International Symposium on Sound Waste Management in response to the pandemic of COVID-19. I'm Shin Sakai of Kyoto University, International Chair of Japan Society of Material Cycles and Waste Management. First of all, on behalf of International Committee of Japan Society of Material Cycles and Waste Management, I would like to appreciate all the participants, mainly to say special thanks to all speakers' acceptance of our invitation to join this symposium. We'd like to share latest information and have a discussion on waste management in the context of COVID-19 pandemic worldwide. I hope you all enjoy today's program. COVID-19 pandemic affects people's lives worldwide. As of today's newspaper, the global number of people infected is approximately 30 million, and the death toll reaches almost 1 million. Even if we could succeed in curbing the first infection temporarily, the second or third wave of infection takes place in any place in the world. The COVID-19 is still an ongoing problem. On the other hand, our infectious disease program deeply related to waste management. For example, waste management in modern times of Japan started in order to improve public health conditions. We have a successful experiment of remarkable reducing of prevalence rates of dysentery and cholera owing to the sewage system development and promotion of waste incineration techniques. Amid COVID-19 pandemic, we need to take a new look points of attention for management of infectious waste based on the new information. Under the coronavirus pandemic, there is an increasing recognition that waste management is an essential and key public service in our society. It is necessary to develop detailed measures to prevent waste management workers from coronavirus infection, and also to create policies to keep sustainable waste management. Today's symposium is comprised of 3 parts: a lecture by UNEP and IGES for the introduction of their recent reports. Second, 6 countries and regional reports. And finally, issuance of joint statement on sound waste management in response to COVID-19 pandemic. We have to finish all these things within only 2 hours. Therefore, we would like to each of you to give a talk in succinct manner in order to keep a time limit. We are sorry we can't give enough time for your presentation, but I hope you for your kind understanding and cooperation. Okay, first of all, I would like to introduce the first speakers for special lecture. Mr. Onogawa of IGES, Institute for Global Environmental Strategies, and Ms. Misato Dairy of UNEP, United Nations Environmental Program. Okay, please, Mr. Onogawa and Ms. Misato Dairy, please.
Thank you, Professor Sakai, and good morning. And thank you very much for the invitation to me to this international symposium on COVID-19. I am from the IJUS Center. Why it doesn't move? Oh, it's okay. Okay, I am from IJUS Center, collaborating with UNEP on environmental technologies. In short, it is called as CCET. It is one of collaborating centers of UNEP in the world, and our work is focused on waste management currently. First, let me introduce the report which CCET and UNEP ITC have developed recently, which is waste management during the COVID-19 pandemic from response to recovery. UNEP Publication Board has decided to publish this report as a UNEP key publication at its publication board meeting. Following this decision, UN headquarters at New York also introduced this publication in UN newsletter, UN library, and others for circulation among all the UN organizations, governments, and public. UN Habitat, for example, echoed to this action and reported the publication on its newsletter as well. You can download this report from IJUS CCET website or UNEP website. Also, Japanese version would be available soon. I hopefully in early October for the convenience of Japanese readers. We have started to develop this report in the end of March this year. It was a time that COVID-19 had started to cover the world. It was because we found there was almost no guideline available discussing COVID-19 subject and with a focus on developing countries as targets. Already available guidelines on infectious waste management are rather general in nature without distinctions between the conditions of developed and developing countries. There are a few guidelines which discussing COVID-19, but again, they were rather superficial. Also, those guidelines were prepared for the ordinary social conditions of the society, but not for the pandemic conditions when the society is under strict constraint of capacity to work on waste management. That is why we came to the decision that we should develop a set of information for the use of developing countries for COVID-19 subject. We have analyzed 17 international guidelines issued by WHO, UNEP, UN Habitat, US CDC, ISWA, ADB, and others. Also, 32 national regulations and strategies of Asia, Africa, and Latin America. Also, we have prepared a detailed questionnaire and sent it to those developing countries. In response to this request, fortunately, we could receive responses from 14 countries. As you can easily imagine, there is a big gap between these desirable options and affordable options for developing countries. Then question arises, how we can find realistic options on waste management while respecting the principles of international guidelines. The question is, what would be the affordable options we can take under the limited capacity of developing countries in terms of facilities, staffs, and financial constraints? While seeking an answer for this question, we were curious to learn the operation of neighboring developing countries or other countries whose economies are under similar conditions of development. There is a good reason to cooperate or learn each other among these countries. This is the compilation of the answers we received from 14 countries in Asia, Africa, and Latin America. This is developed following the flow of waste management, starting with the generation of healthcare waste as the left side and toward the final disposal on the right side. If we have a close look of the treatment technologies on the slides before, the figure unveils interesting information which happens on the ground. Yes, incineration is accepted popularly in many countries, but it also shows dedicated landfill or chemical disinfection as alternative ways of treatment. Also, it shows cement kiln as an option in lieu of waste incineration facility. It even includes burning in open container or place as well. Naturally, open burning has a risk of infections for workers. However, they are the real conditions, technologies being taken in those countries as an answer which those countries and cities decided to take after due consideration of pros and cons of respective options. We can learn the real and practical operations of infectious waste treatment from this slide. This survey has unveiled strong and weak points of various technologies. While incineration is widely recommended among almost all the guidelines issued by various authorities, the question is, what is the available technology if incineration facility is not feasible? Also, WHO is concerned with on-site incineration due to generation of PCDDs and is in favor of landfill, but with careful operations. However, some experts are concerned with the landfill due to possible pollutions while they are transferred and landfilled. Then, next subject is how to be prepared for the development of Build Back Better scenario. Not only to respond by taking quick actions for COVID-19, it is a common understanding of our society now that we need to redesign our society when this COVID-19 is controlled. It does not mean simply going back to the same condition we had before. Once situation comes better, it is a time to consider such a Build Back Better strategy for waste management as well. This figure shows or suggesting considerations we have to take in that work. In addition to the report, we have compiled an additional detailed information we received, which could not be included in the report due to the limited space available. You are invited to visit CCET website for supplemental detailed information for deep understanding of the conditions of those countries. For your information, this detailed information is available only at CCET website. Also, we need to be prepared for the coming of next wave of COVID. We had experienced Spanish flu in 1918 to 1920, which is 100 years ago already. But after that, SARS coronavirus came in 2002 and MERS coronavirus in 2012. And now we have COVID-19 in 2019, which means we are having such strong infectious coronaviruses 3 times already in these only 20 years of time. The final slide is an invitation for the collaboration with the research network. CCET is working on waste management subjects in developing countries, and we are looking for participation of the members of this association in this effort. Waste management in developing countries has various difficulties as introduced above, and we need to find tailored answers for each case. There is no single common answer for all, and today's answer is not the answer of tomorrow. It is a challenging work. We have benefited from the contribution of professors and academicians already, and we appreciate it. In addition to those, I hope we can develop further collaboration with universities and experts taking this opportunity. Lastly, but not leastly, women play an important role in waste management. My colleague from UNEP ITC, Ms. Misato Dili, is with me today, and she will discuss this important subject, gender, in her discussions. Misato-san, the floor is yours. Thank you very much for your attention.
Thank you very much. Thank you very much, Professor Sakai. Thank you very much, Onogawa-san. So my name is Misato Dili. I'm from UNEP International Environmental Technology Center, and I would like to quickly cover this topic of COVID-19 and gender in waste management. Before going to gender, I would like to quickly recap what's the difference between sex and gender. Sex refers to whether someone is biological male or female, whereas gender refers to the roles, behavior, activities, and attributes that a given society at a given time considers appropriate for men and women. So why this gender matters? Well, we wanted to bring this topic in the report as waste management is often considered gender neutral. However, women and men are affected by and are involved in the management of waste differently due to existing gender inequalities, responsibilities, and roles. And there's still little gender disaggregated data on waste and COVID-19. However, there are many underlying factors which suggest that the COVID-19 pandemic will put women at a greater risk. So let's look at some examples of underlying factors. The findings that I introduced here is based on the study we published last year, 2019. So the study conducted in Asia found that there seems to be a division of labor between men and women in the waste sector. And in the absence of adequate waste management services, in many communities, women are often involved in voluntary community, like cleanups, street sweeping, and even primary collection of waste, which meant that these tasks are either lower or even unpaid tasks. Whereas men are often taking a position of city managers and planners to landfill operators and managers of waste collections company, which meant that they are upper level decision-making positions, and usually these tasks are paid. And it is also common to find that men mainly collect waste and sell the segregated materials, while women segregate the collected waste items at home and are responsible for disposing of those with no value. Such a division of labor makes women's work invisible or less valued. And even these different laws may expose women to higher risks of infection during the COVID-19, a serious economic threat to women, and could increase gender gaps even more. So related to previous point, in Asia, women as well as children are integral part of the informal sector, making their living from waste collection and or recycling. This means that they often perform duties with limited or no safety equipment and for basically nothing. And due to the COVID-19 pandemic, women may be put at a considerable risk when infectious waste is dumped at the disposal site. If the COVID-19 continues, it may pose a serious challenge both socially and economically. And in addition to that, gender aspects are often left out in many existing waste-related policies and guidelines, and including COVID-19 guidelines as well. So mainstreaming gender in the waste sector could be an opportunity to improve waste management in a more resilient and sustainable manner, especially times like pandemic, COVID-19 pandemic. And for example, appropriate segregation of waste at household level, women as well as men can play a valuable role not only to ensure safety, but also in accelerating waste reduction as a whole. So all this leads to the need for gender perspective to be incorporated into waste management. The effectiveness and sustainability of waste management can be improved through incorporating a thorough understanding of gender dynamics and gender division of labor. Yet the nexus between waste and gender is not well studied. So we need to start collecting gender disaggregated data in the waste sector. And then we also need to support women to be part of the decision-making process when it comes to waste management. Even when we want to introduce new waste management, waste treatment technologies, we need to consider the women's perspective. And most importantly, we need to make sure that the women as well as men can have access to information on safety measures, as well as health services and insurance. So these are the recommendations that we concluded in the report. So that's it from me. Thank you very much.
Okay. Thank you so much, and Misato-san, and also Mr. Onogawa, for your nice introduction of your recent reports of a very comprehensive and also some practical point of view, especially Pacific and Asian region. Okay, we'd like to open the question time from the audience, and at the moment, I don't have a message from the secretary, and therefore, if you have, and especially some panelists and have questions to Mr. Onogawa or Misato-san, and would you please raise a hand, please? Okay, and small question to Mr. Onogawa, and your survey on the some treatment methods of in Asian countries. Okay, how much is total numbers of answering countries? You reported over some installation with some autoclaves is more than 4 countries using in your slides. Total numbers of answering countries, would you please introduce, please?
Thank you, Professor Sakai. As I introduced in my presentation, we have received the responses to the questionnaires from 14 countries, but it's not limited only to Asia, but also including the countries in Africa and Latin America. But all of these 14 countries are from developing countries, not including the European countries or United States, Canada, and others.
Okay, thank you so much, and a very clear answer. Thank you. Okay, another question? Okay, now we would like to continue on the next presentation of the country and regional reports in the today in the very limited time, and for each presenter will be 10 minutes in the presentation. Okay, the first report from the Nepal, Dr. Nawaraji Kachiwada. And, okay, would you please start your country reports, and would you please share the screen by yourself, please?
Good morning, all of you. Ohayou gozaimasu. I would just, this is Nawaraj Khatiwada from Nepal. I would just like to know if you can see my slides and if you can hear me.
Yes, yes, please.
Okay, thank you so much for organizing this wonderful event and inviting Nepal for this presentation. So I'm representing two organizations here, Society of Environmental Engineers in Nepal and Nepal Development Research Institute. So moving ahead, so if you, the colleagues here, if you are not familiar with the country Nepal, you can see we are just in between the China in the north and the India in the south. So if you look at the, solid waste generation, you can see because in the north side, we have got the mountains from east to west. And so you cannot see much, waste generation there. So these dots here are representing the urban areas and then the waste generation. So the waste generation is focused in the south, that is in the plain area, as well as in the cities, mainly in the hills. So as I said, in the north, we have got the mountain like this. So there's no, question of waste generation, but we do have a problem in the mountains because many, adventurous sports people would like to go to the mountain for mountaineering and like that. So they take the waste and then, quite often they leave the waste there. So there is a burden to collect the waste and bring them back from the mountains. That is one issue in the north. So if you talk about the general solid waste, situation, we are a country with a population about 30 million, and then 40% of that is covered by the urban areas. And 40% of the population, live in the urban areas. So about, 12 million in the urban areas. So if you talk about the waste generation, it's approximately 0.5 kg per day for individual, every individual. So that is about 5,600 tons per day if you look at the whole country. And then collection of waste and disposal, the cost is about $30 per ton. So now if you look at the, urban areas, it's the urban areas are coming very fast. You can see on the slide on the, picture on the left, that in 1996, we had merely 53 municipalities, but, now we have about 300 municipalities. This is how the people are moving from the rural to urban areas. If you talk about the solid waste here, so about 2/3 of the waste is, organic. So it's very easy to manage. If you compare with Japan or any other developed country where you have a big share of inorganic waste. But the point is, still we take the waste to the landfill site and so on. Now, if you talk about the COVID-19, we had a first infection in 23rd of January 2020, when a 31-year-old student who returned from Wuhan, China, was, confirmed COVID. And then first death was there on May 14, 2020. A 29-year-old female died as of the COVID and other, issues. And so countrywide lockdown started in March 14 and then ended on 21st. But still, we are having, different types of restrictions. If you look at the COVID cases throughout the country, so this is the latest from yesterday, the data. Until yesterday, we had 379 deaths, and then 41,706 were recovered, and then about 16,242 total infection, and about 60,000 total cases. So this is the situation. If you compare with the other countries, so we are, you can see in this slide that how, in comparison to the other countries, our curve, started to rise and like that. So we are on the left side of the curve, as you see on this slide. Now, I would like to now more focus on the solid waste management. So as I said before, we produce about 5,600 tons per day of the waste in the whole country, but that is the waste generation. And in the Kathmandu city alone, there are about 5 cities there. It's a valley, and then there we generate about 1,200 tons of the waste every day. Talking about the COVID, what happened was there were, on the on the waste generation, there were cases of increased generation, also decreased also. Some factors, added to the increase, some added to the decrease. Like many individuals left Kathmandu, and then commercial areas, restaurants, hotels were closed. So less waste, you can say. But initially, that because the people were in lockdown situation, so they were in home, they had nothing much to do, so they cleaned their house and like that. So there was an accumulated effort of that, and then we felt kind of increase in the solid waste production. And then and another factor was initially the waste was not collected for several days because the waste workers were scared. There were no clear-cut instructions and like that. And then another problem with us is because we had most of the rain in the rainy season that lasts from May to August. So because of that also, because if you have rain, then the waste volume and the weight is increased. So workers initially hesitated, and then because there were no clear instructions, and then even the authorities, didn't know what sort of case was that, and like that. Some precautionary measure was applied, but they were not continued seriously. People took it very easy, after some time, and so business as usual, situation continued in collection and disposal. Many households started composting and rooftop gardening. That was the good part. So you can see the line of the trucks going to the landfill site, and then because of the rainy season, sometimes the roads were closed out of landslide and so on. So this was the kind of situation. So I'd just like to give you in this slide a glimpse of the solid waste collected and which was taken to the landfill site. There are about 95 trips in a day going to the landfill site. So that was, so these 95 trips took about 3,000 tons of the waste, and then on an average 750 tons per day to the landfill site, which is about 25 kilometers away of Kathmandu. So the authorities, put some notices in the media and like that, and then they said because the landfill site is closed, so people are requested to manage their waste in their house. But the point is they did not tell much about how to handle the waste, how to segregate the waste. They just put the notice in like that. You can see some other notices here because the waste collection is considered as the essential service, and there were some relaxation for the waste collection and management. So you can see some of the news covered in the media, and then you can see some of the pictures here where people are using bare hands to collect the waste and they manage the waste. And but there were some sort of training, capacity building, awareness campaign and activities. One of that you can see on the slide here. So there are some photos here. I mean, how the private sector and the civil society and even the authorities were involved in this sort of campaign, and then informing the waste pickers, waste collectors, and then these workers who are directly, in the field working there. There are some notices put on the, street. This is next to my house. This is the COVID phenomena, I would say. Some notices are there and now related to COVID and so on. And then this is, as I said before, the silver lining of the problem. I mean, we started, many households started with the composting and making the fertilizer out of the organic waste. As I told you, 2/3 of our waste is organic. So this is from my house, you can see, so this is what we did in the lockdown, some, putting some flowers and then using the compost to do that. So, and at the, this is my last slide. I would just like to tell you that although, it was very new, as told by our previous speakers also, we didn't know what to do, but we mainly followed the WHO guideline, which is shown here, but we did not follow much the Sendai framework for disaster risk and risk reduction, which clearly stated about the biological hazards and this sort of pandemics, what is the role of the different institutions and like that. So I believe this is same to other countries also. And then, I also appeal to all of us that we should not forget what we have done in the past regarding the risk reduction, and we have to, in fact, move on with that. And then because we put a lot of efforts in bringing the documents like Sendai framework and so on. With this note, I would like to thank you once again. And this is the end of my slide. Thank you so much for listening to me. And I would be very happy to answer your questions if you have any. Thank you so much.
Okay, thank you, Mr. and Dr. Nawaraji. Okay, nice introduction of the many actual survey of social activity in Nepal. Okay, after 6 presentation and our country and regional reports, and we will have a discussion time in that. Okay, next, and I would like to introduce Miss Shitam Kongrado from Thailand. Okay, would you please share the screen, and would you please start the presentation? Ms. Shitam, please.
Yes.
That's very nice. Okay.
Okay. Thank you. Good morning, everyone. Okay. The slide is showing. Okay. Good morning, everyone. I'm Sitang Kongkatop, a lecturer from School of Health Science and a member of Q Research Center, Maphalong University, Thailand. For today, I would like to talk about the waste management according to COVID-19 in Thailand. So we have to discuss in 3 content about the waste management in the normal situation and what we do during COVID-19 pandemic and alternative options to improve the waste management in Thailand. So here is the trend of solid waste in Thailand from the 4 big cities in Thailand. The solid waste during COVID-19 pandemic getting lower than the normal situation, but the proportion of plastic waste is higher, around 60% from normal, because most of people have to do online shopping and food delivery the food, so the plastic packaging is becoming a big issue in Thailand. About the infectious waste, there are 29,000 healthcare facilities in Thailand, such as a hospital, clinic, lab, and we have 34 licenses to operate the transportation about the infectious waste, and we have 12 disposal points operated by the local government companies and the universities. The infectious waste in Thailand managed by the Department of Health with the manifest system. And this system can track the infectious waste from source to the to the disposal point. In each area of the healthcare institute, they have to prepare the bin with the red color bag and classify the infectious waste into type, sharp and non-sharp. So every day for 1 or 2 times, the waste collector will use the specific equipment to collect the waste, record the weight, and transport to the storage area in the location. So this flow chart shows the detail of infectious waste management from the different sources in Thailand. From the sub-district level, we will store the infectious waste at health promotion hospital and then transfer to the district hospital. For this one to this one. For the private clinic, have to transfer to the district hospital too. For private laboratory, they have to dealing directly to the local government and private company to transport and treat all infectious waste. For the safety measurement for infectious waste collector, the waste collector should be training about the safety operation. They have to do the health check-up every year, and they have to vaccination. And the facility will provide the personal protective equipment for all waste collector. But if they have an accident during work, the supervisor should investigate to find out the cause of accident and take the action to correct the problems. During the COVID-19, there are more sources of infectious waste, such as cohort wards, hospital, and the state quarantine. And in the community, they have many surgical masks because in Thai have to promote to wear the mask in every public area. For this case, the Ministry of Public Health estimate the quantity of infectious waste during COVID-19 per individual per patient around 3 kilograms per day. But the statistics show like this. During COVID-19 pandemic, the infectious waste per individual patient is 7.5 kilograms per day. For the state quarantine, they show about 1.2 kilograms per person per day. And in laboratory, will be generate around 0.1 kilogram per sample. In the community, they have a program to manage the infectious waste during the time, but no statistic record. Here is the trend of infectious waste in Thailand related to the number of COVID-19 patients. Just only about the waste from COVID-19. This is the data collection from January to end of May. And this is the number of testing for COVID-19 per day in Thailand. In overview, the trend of infectious rates during COVID-19 pandemic is lower than average in year 2019. The trend has dramatically decreased after the lockdown period because many healthcare facilities are closed, and the trend is increasing again after the facility can operate in May. This is a specific practice in each area to manage the waste from COVID-19 in Thailand. In healthcare facilities, no new facility has been installed all that time. But in the community, the local government prepared the red bin like this for disposal masks, and they have to prepare the personal protective equipment for the waste management staff to protect themselves from biological hazards. The last session about the transportation and treatment, they require to treat the COVID-19 waste within 48 hours and require to clean the vehicle and bins with the sodium hypochlorite to disinfect. For the new technology that becoming happens in Thailand, Q Research Center has decided application to manage the infectious waste. So this application is under testing process by district hospital in Chiang Rai province. So we plan to cooperate with the Department of Health and merge this application with the manifest management system. This application can help the user to monitor and about the quantity of infectious waste in the area and can monitor until the waste transfer to the disposal point. From this one, the facility for hospital facility and transfer by the truck to the disposal area. Here is the demonstrate off screen from the waste management application that we have to prepare and under the developing. The data will show like a dashboard, so that you can find the number of sharp items, non-sharp item, and for the special waste, special hazard, infectious waste, such as right now we have to face to COVID-19. So this application can separate the waste from the pandemic or in case of emerging disease. To summary about what we do in Thailand. In Thailand has a good level for waste management, and we have a low potential epidemic of COVID-19 because Thai citizens have a high cooperation to prevent and control the disease. In the community levels, has produced the infectious waste, but the local government have to create plan to control this issue. Then you can find that they prepare the red bin for collect the disposal mass. Arigatou gozaimasu.
Okay, thank you very much. So something will be happen on Professor Sakai. Okay, yeah, sorry.
Okay, so sorry, and I keep mute of microphone. Okay, next, we'd like to invite from the Pacific Island, PNG Papua New Guinea, and Mr. Anthony Tauri, and also from Papua University of PNG, Professor Frank Griffin. Okay, would you please prepare your slide, and would you please share in your screen, please? Mr. Tarori or the Professor Griffin, would you please?
Hello.
Yes.
Do we upload the presentation onto the screen?
Yes, please. And would you please share with your screen by yourself, please?
Okay. I'm trying to load it, but it doesn't seem to be loading. Sorry, I need some help here. Can somebody advise me on how to upload the PowerPoint presentation?
Frank, so this is Marco speaking.
Marco.
Yeah, so here we can upload. So we can ask to the organizer.
Yes,
yeah, to
that's why
upload from their side. So Asari
yes.
Sensei, can you upload from your end?
Okay, we can do it, but would you please pass one speaker?
Okay.
Can I change the yeah?
Order, right?
Sorry.
Okay. First of all, we'd like to invite our Professor Pinji He, and this time, and after that, over some Professor Frank will be presented. Okay.
That's fine. Thank you.
Professor Pinji He. Okay, very nice. Yeah. Tongji University of China and Professor Pinji He will introduce over some their experience in that. Okay, please start in that. Professor He?
Yes, yes.
Okay. Would you please
okay.
have some 10 minutes, please?
Yes. And hello.
Yeah, hello.
Can you see my slide?
Yes, we can see, and also we can hear clearly.
And but in my computer, I face some problems.
Hey, Sensei, can you hear me? Professor He, can you hear me?
Yes, I can hear you, but my computer faces some problem.
Okay, so if you don't mind, we will share the your slide. So if you can see, you can just talk.
Okay.
But we can see your slides now.
It's clear?
Yeah,
Can you see? And can you see me? See my slide and hear my voice?
Yes.
Okay. So hello everybody. Hello and thank you Professor Sakai and for your invitation for me to have chance to attend this meeting. And good morning. My name is He Pingjing from Tongji University, Shanghai. And here I will give a brief introduction to waste management in China in response to the pandemic of COVID-19. And the talk includes three aspects: the challenges brought by the pandemic, waste management actions taken in China, and the work of our team. And we start from the challenge for waste management introduced by the virus. And in China, you know, the COVID-19 pandemic started in January, and as increasing pneumonia cases were reported, which was induced by a novel coronavirus. And the virus was later named SARS-CoV-2, and China acted immediately to stop try to stop the spread of this virus even in the Spring Festival time. In January, the public have been suggested to use face masks when going out to prevent the infection of SARS-CoV-2 transmitted in aerosol. And such actions took effect, and in no more than 3 months, the spread of the disease was controlled, and the daily increase in domestic coronavirus cases fell to single digits, as you know. And however, during the pandemic and the late periods, the usage of personal protective equipment largely increased, which finally went to the waste flow. And as seen from this table, quite some types of viruses can be transmitted by direct contact or indirect contact, like aerosol and fecal oral routes. And SARS-CoV-2 has been detected in aerosol, droplets, and feces. It can thus spread via direct and indirect contact. And the masks, gloves, tissues, toilet paper used by the virus carriers can be contaminated and have infection risks to the public. And various domestic wastes in contact with the virus carriers could also be contaminated to different levels. And what's worse, the virus has a long survival time on the surface of the objects. For instance, a researcher detected infectious virus on the outer layer of masks even on day 7, and increased the infection risk during waste management. And during the pandemic, such virus contaminated waste could be produced in different scenarios, as you see in this slide, such as the designated medical institutions, nuclear acid testing sites, and quarantine sites, and public facilities. And this raised the question on how to identify and manage the potential infectious wastes, which are biocontaminated. As in the peacetime, some are classified as municipal solid waste, but during the epidemic time, they might become medical waste. And such contaminated waste brought various challenges to the management system. First of all, virus infection risk exists during collection, transportation, and disposal process. Increased amount of biocontaminated waste challenged the capacity of the medical waste treatment system, especially the incineration facilities. More incineration could generate secondary pollution. Besides, virus in wastewater also raised the infection risk to the wastewater and the sludge treatment system. You can see in this slide and show you some idea. And then what action did China take? The government quickly realized the infection risk raised by those biocontaminated waste. In late January, the National Health Commission published an announcement to reinforce strict management of waste generated in medical institutions. It is required that domestic waste generated by confirmed and suspected cases should also be processed as medical waste. Experts were organized by the Ministry of Ecology and Environment to provide technical consultation to the public and the local authorities. There were 7 groups with different topics, such as policy and risk prevention, management of medical waste, domestic waste, hazardous waste, and so on. I led Group 4, which focused on the sorted collection, transportation, and the disposal of domestic waste. And the Ministry of Agriculture and Rural Affairs invited experts to make video lectures at that time to train the people living in the rural area and how to safely manage waste during the pandemic. And I gave a lecture on domestic waste management at that time. And during the pandemic and in the late period, the government has enacted several actions, plans to strengthen the management of waste generated in medical institutions. In the revised law on the prevention and control of environmental pollution by solid waste, it is stipulated that government at or above the county level should improve their capability for concentrated disposal of medical waste. And at the same time, the government quickly started several major research projects in response to the pandemic. In early February, the Chinese Academy of Engineering initiated an emergency project. That means prevention and control of environmental risks during epidemic outbreak of phenomena caused by the novel coronavirus SARS-CoV-2. And our team participated in the subject prevention and control of environmental risks in solid waste treatment and the management mode. And 1 month later, National Natural Science Foundation of China published the guide for applying for another major research project. The name is Environmental Safety and Secondary Risk Prevention and Control during major infectious disease epidemics. And from our point of view, there are several principles to handle the waste during the pandemic. As seen here in this slide, the amount and the composition of infectious waste changed, They could be generated in both medical institutions and residential areas, with different risk levels, of course. Therefore, the first principle is to clarify and define the range of infectious waste and classify them to different risk levels. And wastes of different infection risk levels should be sorted first and packaged and collected. And high risk level waste should be disinfected before collection. And collection, transportation, and disposal should also consider the risk level. Strict personal protection and disinfection should be conducted in the whole process, and all waste with infection potential should be incinerated. And our team also did quite some work in response to the pandemic. We developed 4 standards which were issued by China Association of Urban Environmental Sanitation. These standards provide guidelines on separation, collection, transportation, and incineration of municipal solid waste during the epidemic outbreak, as well as emergence actions. We wrote 2 papers also discussing the survival potential for virus during environmental sanitation operation and the management of domestic waste during the pandemic period. And both were published as cover articles on the journal Environmental Sanitation Engineer. As editor-in-chief of this journal, I organized a special collection of the topic fighting against COVID-19, which published 6 papers focused on relevant issues before April. And we also have written a book titled Emergency Management of Solid Waste During the Pandemic Period. It has 4 chapters introducing different emergency measures, which will be published by Tongji University Press soon. And in the pandemic outbreak, a part of the infectious waste is suggested to be co-incinerated in municipal solid waste incineration facilities in China. In order to separate and safely load such waste into the incinerator, we invent a feeding equipment for transferring barreled waste and applied for a patent. This is the major work of our team did on waste management in response to COVID-19. So finally, I should say, sanitation workers are also heroes in harm's way, who should be respected and protected well. So that's all for my presentation. Thank you for your listening. Thank you for Professor Sakai giving me this chance to share our work. Thank you very much.
Thank you, Professor Pinji He, for your nice last message and also some various of scientific evidence, especially some persistency on the survival times, and also your recent results of academic activity. Okay, thank you so much. Okay, once again, we'd like to invite Professor Frank Griffin and other experience of Pacific countries and PNG. Please, Professor Griffin.
Thank you, Professor Sakai. Can everybody see my presentation on the screen?
Yes, please.
Okay, thank you. Yeah. Can I have the next slide, please? Yeah. Okay. Papua New Guinea, like the rest of the world, was in a state of shock when the a pandemic started at the beginning of this year, or late last year, early this year. Sorry, I'm one slide ahead. Can we go back to the earlier slide? Hello? Can I have the next slide, please? Yes. Yeah, so when the global pandemic started, many countries were not prepared, as we heard from the previous speakers. Both developed and developing countries were affected. Developing countries in particular were very much affected badly because of the resourcing constraints. Developing countries in the Pacific reacted very quickly by closing their borders to incoming passengers, so people from outside the country. Internally, this pandemic identified and surfaced many deficiencies that exist within developing country structures. Health systems, as we've had, were very, very stretched. In the case of many of the developing countries, management plans had to be hastily drawn up. Next slide, please. So in Papua New Guinea, the government reacted very quickly in declaring a state of emergency. And as part of the state of emergency declaration, the government also appointed a state of emergency controller with executive powers. The executive powers were used to release emergency orders to manage the pandemic because this was totally new to the country. Resources were then diverted from other areas into bolstering or boosting the health measures to manage the pandemic. And as a result of the pandemic preparations, the country also prepared an emergency preparedness and resource response plan. Next slide, please. Yeah, the Papua New Guinea emergency COVID-19 emergency preparedness and response plan was put in place as a result of that. And I just want to focus on the priority areas of the plan. There were 10 areas ranging from planning for the management of the pandemic, surveillance, laboratory facilities for testing, clinical management and healthcare services, which were very, very stretched, all the way through to coordination of assistance coming from overseas. But in as far as waste management is concerned, it was structured under the number 5 priority area on infection prevention and control. The plan in its detail called for the development of a waste management plan to ensure supplies were available to managing the wastes. Standard precautions for all patients and all health workers was also part of that whole process, which also required the operations to have safe waste management processes in place in as far as the disposal of the waste is concerned. And as we heard from the other speakers, it was to be done using best practice, using environmentally friendly processes. Because this was a new category of waste that we had to deal with within the country, a contract was put out and it was awarded to a total waste management company here in Papua New Guinea. It is a locally established company, but it's recognized globally for their waste management and environmental services. Their standard operational procedures are all ISO certified, and the COVID-19 waste was managed using these procedures, and were consistent with, as we've heard from the other speakers, WHO and UNEP requirements. In our case, we used a three-step procedure. The first part was decontamination. The second one was collection and transportation. And in our case, we also used incineration to destroy the waste. The incineration process, as we all know, results in ash that comes out of it. and it was transferred. It has been transferred to specially constructed waste cells that handle infectious materials. The soil covered later on and then compacted for protection. The WHO guidelines that were used by the total waste management team as prescribed on or shown on the screen. The two in particular, cleaning and disinfection of environmental surfaces in the context of COVID-19, and also water sanitation and waste management for the COVID-19 virus. For the decontamination step, the total waste management team had to develop procedures to be in line with the WHO requirements and UNEP requirements. And the process really was about decontaminating the containers that the waste was put in, as well as we had from Thailand earlier on, the disinfection of the vehicles that were used for the transportation of the waste. And the purpose of this step was really to protect all the health workers and all the waste handlers during the collection and transportation period, which would ensure that minimal exposure of this personnel or the public to any biohazards associated with this quarantine waste. Decontamination, as we all know, is a process of applying a disinfectant chemicals on the containers that were carrying the COVID-19 waste that were collected from our health facilities here in Port Moresby. Disinfectants use the chemicals that were used for the decontamination step were the ones that were recommended by the WHO guidelines, and the concentrations were checked by the chemists on the ground. Disinfectants were transported or transferred on knapsack sprayers, and that were handled by personnel who were fully attired with PPEs. So everything from the head all the way through to their feet were all covered using the proper PPEs. As we can see from these photographs, the knapsacks are the ones that are carried at the back, and the vehicles as well as the containers that contain the COVID-19 waste are being sprayed for decontamination purposes. At the site, when following the transportation from the health facility to the destruction site, there were two lockdown areas. One was at the main gate. As the trucks came in, they were stopped. They went through the first lot of contamination, and the other one was right before they were put into the incinerator. So once the truck with the COVID-19 waste enters these areas, all movements of personnel and traffic was halted. So this allowed for the decontamination personnel and technicians stationed at the mentioned container areas to be able to do their work. At the lockdown area 1, right past the gate, bins, skip bins and the containers, bags, they were decontaminated similar to the practice done prior to the collection of the COVID-19 waste from the facilities. The trucks, as we saw earlier on, were also externally decontaminated. Once this is done, the trucks and the skip bins proceed to the second lockdown area. And this is where the contents of the bin are then removed, and each bag is decontaminated individually to protect all the workers that are associated with this process. Now, once the bins is empty, the internals of the bins as well as the vehicles are all decontaminated again to protect future use. Following all of that, the waste, as we saw with the other countries, the waste is then weighed. The recordings are then recorded on a worksheet. The waste is then loaded into a high temperature incinerator. The waste is then incinerated at between 850 degrees Celsius and 1000 degrees Celsius. The burning time is critical because this is the period when if the burning is incomplete, if the burning is not done adequately, you can run the risk of producing dioxins and furans and PCBs and all those POPs that we read so much about under the Stockholm Convention. Now, upon completion of the incineration, the incinerator is then turned off and allowed to cool down for 12 hours. And as we see in this slide, on the left-hand side, we see the incinerator that is used at the facility we have here in Port Moresby. The ash is collected the next day after it has cooled down, weighed and recorded. The ash then undergoes a test of what is known as the toxicity characteristic leaching procedure. And if it meets the requirements of the analysis, then it will then be placed in the specially constructed cell to handle hazardous waste. So it goes through that process. It's a very stringent process that allows the total waste management team to be able to say, this is okay for landfilling now. Now, in the event that the TCLP requirements are not met, the ash is then further treated again, which is putting it through the incineration again until it meets the requirements of the landfilling for processing. So as part of the Total Waste Management's environmental permit, that is called compliance requirements as required by the government of Papua New Guinea, it is required to incinerate COVID-19 waste within 24 hours of collection. So as you can imagine, once the waste is collected from the health facility, it goes through the decontamination process very quickly, and then it's put through the incinerator and destroyed promptly. The data generated from the COVID-19 waste management operations, like the weights and the amounts, the volumes, the description of the waste, are then put in a report, and the reports are then sent to the Conservation and Environmental Protection Authority, which is the entity or the authority that issues the environmental permit for the total waste management team or business to operate here in Papua New Guinea. And this is an example or extract of the environmental permit that the total waste management business or group operates under. So that in a nutshell is the presentation or description of how COVID-19 waste are handled here in Papua New Guinea. This is only for the Port Moresby area or the National Capital District area. In the other parts of the country, waste actually placed in a landfill, a hole is dug, they're bent and then covered with soil. So we're having to do all the best we can in making sure that the infection is actually controlled over the large area of land that we have here in PNG. With that, thank you very much, and I look forward to talking to you about some possible collaborations later on. Thank you.
Okay, thank you, Mr. and Professor Griffin, for your introduction of experience of PNG, especially some incineration and also decontamination processes. Thank you so much, Linda. Okay, next speaker will be Professor Dae Kim from Korea. He's a professor of Daegu University. Okay, would you please open your slides and share with the audience, please? Okay, thank you. Yeah, please start.
Thank you for your kindness to introduce me. Hello, my name is Dae Kim of Daegu University in Korea, and the member of Korea Society of Waste Management. I'm honored to have a great opportunity to share the information about the waste management in Asia. My presentation of today is the issue of waste management in South Korea due to the COVID-19. As you know, the current situation of the COVID-19 pandemic of the world is very serious problem. This figure shows the state of COVID-19 pandemic in Korea. Yeah, I hope the pandemic is over, but it is continually occurring in Korea. So now, Korea government enforced the social distance level 2 to protect the health of the people. This means, as you know, the same situation, we have to wear the mask to go outside to meet any other people, and no meeting over 15 people's internet class and work at home like that. So I find some interesting survey result in some Korean Herald News. Can you see this picture? The survey showed what people miss the most during the social distancing in the US. How do you think this ranking of some persons eating out or at the restaurant and then retail shopping and like that, watching, listening to live sports, something that. So what do you think about the result? I think I must agree about that. I cannot do I cannot do anything. Some meet the friend with the meeting and something. The COVID-19 has happened a serious problem of the medical waste management. Some country have the same situation. This figure shows the more than 30 tons of medical waste has been generated for 7 months through the COVID-19. This medical waste is expected to increase by more than 20% from the last year. We worried to be over than the capacity of the treatment facility. So this slide shows the summary of some special medical waste management policy in Korea for the COVID-19. Some medical waste policy to have been the stated because for the COVID-19 some medical waste. Can you see something changing? Upside table is about the general medical waste management method. Down table is about some COVID-19 medical waste management method. That is separated storage, transportation, disposal. As COVID-19 medical waste have to move the same day, and disposal have to dispose same day. Is at that very tight method. Anyway, overall, the COVID-19 have a changing the lifestyle. Typically, non-face-to-face work is main trend. We do the work at home, and we do something do in home. So therefore, we use something variable delivery service, food, drink, vegetable, something more. We can buy everything. Buy this delivery service, like this figure. So this delivery service have generated a lot of waste, as shown this picture. Due to the COVID-19, the plastic as the single-use goods and the packaging waste have been increased. Plastic waste has increased by 11 to 15% to compare with the last year. And vinyl waste also was increased by 7 to 15%. Actually, we policy of some prohibited of using disposable cup in the cafe that took effect in the last year before the COVID pandemic has reduced the disposable waste. But now with the policy to reduce the use of disposable cups stopped for period of time at due to the COVID-19. Well, Korean government Korea government is constantly prepare the policy to reduce the waste generation. As the figure, we have considered the multiple use delivery packing, like this figure, and the suggestion the packaging standard, like this one, and development of transport packaging system in the industrial site. Okay, I introduce some Korean state. Okay, thank you. Thank you very much for your attention.
Okay, thank you, Professor Kim, for your nice introduction of the some Korean experience. And okay, and finally, final presentation will be Professor Takaoka from Kyoto University of Japan. Okay, please, Takaoka, please.
Okay, thank you very much for kind introduction, Professor Sakai. Firstly, I'm very honored to have this opportunity. Today, I would like to report to Japanese waste management in the pandemic of COVID-19. Before my presentation, I would like to express my deep appreciation to all medical professionals as well as waste management professionals in the world. Their activities can sustain our society. Today's content is here. So firstly, I would like to talk about the current situation of the pandemic of COVID-19 in Japan. So this is the number of active cases by PCR Japan. So as you can see, you can observe the two peaks. Total active cases was 72,000 at September 8th. Central government declared the state of emergency at beginning of April. But Japan measure is not lockdown, but self-restraint. But activities during the emergency period is very, very limited. This slide indicates that the number of the deaths by COVID-19, as you know, there are time lag between the active cases and the deaths. The total death was almost 1,400 at September 8th. So let's move to the waste management in Japan. So waste management is closely related to the infectious diseases. Almost 150 years ago, Japan stopped national isolation policy. So we imported many things, but also some infectious disease were imported. So during this period, outbreak of cholera were often observed, as shown in this graph. This graph indicates the number of the patients infected with the waterborne diseases. Therefore, central government announced the garbage should be incinerated in the outbreak of cholera. So the incineration treatment is a very popular in Japan, as shown in this figure. So almost 80% of the municipal solid waste incinerated. I think that announcement is the origin of the high incineration ratio in Japan. After then, Infectious Disease Prevention Act and Unsanitary Substance Screening Law was established. So this is the first waste management law in Japan. So waste management is regarded as a public health measure. Therefore, waste treatment and management are crucial backbone activities for our societies. So waste contaminated by COVID-19 is one of the infectious waste. In Japan, we have already had some important manual and guidelines for infectious waste control. Medical institution and disposal company must follow the manual and guideline to treat infectious waste, including collecting, storing, transportation, and disposing of. I would like to briefly introduce the characteristics of Japanese infectious waste management. Firstly, so we judge whether the waste is infectious waste or not waste using this flow chart. The ratio of the infectious waste and non-infectious waste is generally 15 to 85%. So we have to display the infectious waste and non-infectious waste like these labels. Discharge amount of the infectious waste in Japan was about 400,000 tons annually. In Japan, the amount of infectious waste has not increased because normal medical care decreased during COVID-19 pandemic. Infectious waste was regarded as a specially controlled waste, that is hazardous waste in Japan. To prevent from the transmission COVID-19, so safe handling is required. All infectious waste must be put into the containers or box, and waste were transported and disposed of without open by workers. In Japan, more than 90% of infectious waste is incinerated. The waste have to supply to the furnace without manual operation. In this time, so potential infectious waste are present in municipal solid waste, as you know. Therefore, we have to clear the transmission from the municipal solid waste. Since beginning late January, Ministry of Environment have delivered many notice and awareness pamphlet and compiled the most relevant question and answers. These are awareness pamphlets for the citizens, for medical institutions, for temporary lodging facilities, for waste transporters. And finally, recently, guidelines for the measures against the COVID-19 in waste treatment have been just published. So during the pandemic, the COVID-19, the change are observed in the municipal solid waste generation. This slide indicates Tokyo 23rd ward. This area is the most urbanized area in Japan. In Japan, the municipal solid waste composed of the 50 to 75% of the household waste and 25 to 50% of the business activity waste. The blue bar indicate that so household waste, and orange bar indicate that so business activity waste. So as you see that So household waste amounts are increased, but business activity waste is decreasing. Totally 7.1% of the municipal solid waste decreasing. This is a Kyoto City case. in household waste, each category, such as a combustible, recyclable, plastic packaging, and containers, that increasing 5 to 50%. But business activity waste decreasing dramatically, 15 to 25%. So total reduction 5.1%. So at the beginning of the emergency period, used face mask was observed in the recyclable plastic waste. Therefore, many local government and central government announced the appropriate segregation and handling of used face masks. This is a Kobe City case, also similar trend in the household waste observed. Surprising, the amount of the incombustible waste also dramatically increased. So during this period, many people clean up the house. This suggests stock waste in our house was so large. So this is a business activity waste are also decreased, but total reduction relatively small, 2.6%. At last, I would like to list up the challenges in the post-COVID-19 in waste management in Japan. So we list up the 8 challenges: change of lifestyle, keeping the environment clean, business continuity, restructure of the supply chain, and digitalization society, and non-contact automation and remote technology, and enhancement of the 3R renewable, and health aging in elderly society. So today, the time is very, very limited. I cannot explain in the detail. So next time I would like to talk about it, okay? So I would like to summarize my presentation. The pandemic of the COVID-19 affect waste composition, generation, and the hidden problems become apparent. Waste from home is increasing, whereas business activity and infectious industrial waste are decreasing because people's lifestyles change and industrial activity are low. In my observation, at present, no serious problem has happened in waste treatment in management for infectious waste and municipal waste in Japan. The pandemic of the COVID-19 accelerate that 3R plus renewable policy and digitalization society and decentralization society, which suggest construction the regional circular and ecological superior. Okay, I would like to finish my presentation. Thank you very much for kind attention.
Okay, thank you, Professor Takaoka, for your nice survey and including the historical backgrounds of Japan and also a new guideline and also some effect on the waste generation during the COVID-19 the pandemic. Okay, thank you so much. Okay, the original this symposium and will be stopped at noon. And but we have so much of information has been introduced, and if possible, if your time will allow in the 30 minutes of more until the 12:30, would you please participate in that? Okay, and we'd like to discuss on the some country and the regional reports. Okay, and especially for the panelists, and would you please raise a hand, and especially just between the panelists and the panelists and the question, in case of a question. Okay, and I would like to several questions from the audience, and especially for the Miss Shitam, who was Thailand, and also who was Professor Pinji He, Miss Shitam, and several questions we received over some
yes,
special root control for the infectious waste in your country. That was infectious waste management of special control of the some collections and transportation and routes, and also a special and cart, specific cart type you have. Such a questions has reached us in the.
Okay, yes, I have to answer in the chat room, and I will talk again about the root cause management for transport the waste in each area in the hospital. We have to design the specific route to collect the infectious waste from each ward to the storage room, and from the storage room to the disposal point. The transport will drive along the specific route way. Yes. The normally is we have to design and operate under the HA standard. Yes.
Okay, thank you.
Thank you.
Okay, another question is Professor Sung-Fu Lee from Korea to the Professor Pinjin He. Okay, Professor Lee, can you speak in your microphone? Okay, it's impossible. His question is some waste personal protection equipment in Korea, and should be transported to the incineration facility of hazardous waste or the medical waste. Korea doesn't allow to go to the municipal solid waste incineration. Okay, his question is how about the status in China? And therefore, the Professor Pinjin He, would you please answer this question, please?
Okay. In fact, I already answered and written my answer. And yeah, so in fact, in China, we are formulating the guideline for the treatment of PPE waste in municipal solid waste incineration under emergency condition. But the precondition is, such PPE waste should not be the medical waste generated by confirmed or suspected cases. They are only PPE waste generated by common people in normal life during the epidemic outbreaks. You know, you can imagine the so big amount of this kind of waste. It's almost impossible to go to the medical waste incineration plant. So those waste should be strictly packaged and disinfected before going to the MSW incineration plant. So the precondition is very important. So that's my answer. Thank you for the question.
Okay, thank you, and Professor Pinjin He. And this is a very important point, and therefore some very fruitful for your answer for all the audience. Okay, thank you so much. Okay, from the panelists, if you have some specific question to the specific presentation people.
Professor Sakai,
yes,
can
please.
I ask?
Please.
Yeah. Okay, so very impressive presentation of all members. So I have a question about the Thailand case. Okay. So in Thailand, so you estimate the amount of that infectious waste during the pandemic. So 2.85 kilogram person per day, etc. Maybe. So today you show that slide.
Yes, I have to show the slide.
So
the number of
could you tell me that how to estimate that amount of
the estimate is from the Department of Health, the Ministry of Public Health, but the real life, the same organized is have to monitoring about the amount of infectious waste from the hospital, from the cohort hospital. Yes, I have to present for the predict that before the period of the pandemic outbreak and the real life.
Okay, so that means that I a little bit wondered. So 2.85 kilogram per person per day. So that person means that is a patient, and could you tell me that?
For patient, 7.5 is for patient, yes, in the cohort ward.
Yeah. Okay. Yes. Thank you very much. It's correct.
Welcome.
Yeah, very good points over some unit generation amounts of the some definition of the some total numbers of people. You mentioned about some total number of patients in the, but not only a patient but also some working people or some other the people who will join or the some management. Don't you count over such a number? Mr.
Yes, the number of patient
and also working people and some management people will join to keep the some such activity in there.
Yeah.
Okay, would you please check over some definition of some basis of total numbers?
Yes.
Yes, please.
I will check again.
Yes, please. Okay. Thank you.
Excuse me, Professor Sakai, I have to respond to two questions, if you allow me, very quick.
Please, Nawaz, please.
Okay, thank you. Thank you, Professor Sakai. Two questions were raised on my presentation. First was regarding the if there is any issue regarding the medical waste management and how NGOs were collaborating during this lockdown period. So my response to that is in Nepal, the hospitals are supposed to manage the the infectious and the hazardous waste by themselves, and general waste from the hospital can go to the mainstream process and to the landfill site. So all the hospitals are interested that way. That is number one. Second was the quarantine centers and the home isolation, because some people are there in the home isolation also, and they were told to keep the waste for 72 hours at least before they give it to the municipal authorities or the private collectors. So they were requested that way, and then assumption is that there will be a natural die-off, and then no more contamination after 72 hours. That was the point. And NGO collaboration and private sector, of course, the private sector and some of the NGOs are managing the waste also. So there is a collaboration going on. Another question is on the financial resources and the composting. What were the financial resource for the composting and like that? So my response to that is this COVID, we have got 7 provinces and many local authorities. They were interested with the management of lockdown and then quarantine centers and like that. And then schools were, because schools were closed. So, use the schools as a quarantine center. But there is no specific, address to the waste management. It's the normal leave we manage, and that 72-hour principle also was there. And then regarding the composting, it's a local composting or the household composting rather. And then every household are, because, doing that, but it's not ubiquitous. It's not universal. I mean, only the selected households are doing that. So government and the local authorities need to intervene on that. Thank you so much. Thank you so much, Professor Sakai.
Okay, thank you for your answer, Navaraji. One more question is some the financial resources of NGO activity in your countries. How about?
Sorry, Professor. Once again, please.
Financial support for NGOs activity of waste prevention or some other activities.
Yeah, I mean, especially the NGOs, I mean, not the NGOs which are on the development sector, but private sector. There are private sector operators. And then some of our colleagues are also attending the event today. The private sector operators, they take the fees from the household. Like I pay about, 400 rupees per month to these, private sector operators. And then they manage the waste. That is the case. And there are, of course, some of the NGOs also doing that as a private sector operator. Thank you.
Okay, thank you, Mr. Navaraji. Okay, and my time management is not so good, and therefore the some already and the 2 hours has passed in the. Therefore, the some I would like to close our discussion session. Anyway, the some from the discussion that today. We cannot stop of the waste treatment, waste management service anytime and anywhere. And therefore, the first priority and should be done for the waste management workers over health. That is some very important points, and also the some necessity to taking ahead of everything at each process of waste separations at source, to collection and transportation and treatment and disposal. And also some scientific knowledge about such as some persistency today from the China experiences that they introduce over such as scientific over some knowledge and should be and should be kept and we should tackle. Okay. Thank you for your joining over today's over some country reports and the regional reports. And okay, and I'd like to hand over next program over some statements over signing ceremony to Professor Sodeno and Dr. Asari. And please continue over the some next program, please. And
okay, thank you, Professor Sakai.
Please.
And hello, everyone. I'm Reiko Sodeno from Shibawara Institute of Engineering. Given the big impact of COVID-19 pandemic to waste management field as well, we think we have to take action as an academic body for contributing society. Here, I'd like to announce that we, societies of waste management from 7 countries and a region in Asia and Pacific, decided to issue the joint statement on society's contribution to sound waste management in response to the pandemic of COVID-19. Now, I'm pleased to introduce you our 7 distinguished representatives of societies as signers to the joint statement. So for signers, could you turn on your video and give us brief self-introduction? So first from Japan, Toshiaki Yoshioka, President, Japan Society of Material Cycles and Waste Management.
Yeah, thank you very much. And my name is Yoshioka, the President of the JSMCWM. At first, thank you very much to take part in this symposium. And we think and believe this symposium will be one of the good opportunities to share and discussion field for as medical waste management, also in the waste management, in the infections, disaster countdown measure. Thank you very much.
Thank you. Then let me invite Jae-young Lee, President of Korean Society of Waste Management.
Yeah, good morning, everybody. Nice to meet you. My name is Jae-young Lee. I'm professor of University of Seoul. This, also, I'm going to present of Korean Society of Waste Management. I really appreciate that it's joint this ceremony, especially COVID-19 is worldwide pandemics. So we very carefully, we very significantly handle for that is we're gonna take off that COVID-19s every countries. It's nice to meet you. Thank you.
Thank you. Then let me invite Ganesh Chao, former Minister of Environment, Science and Technology and advisor to the Society of Environmental Engineers of Nepal.
Hello, good morning and namaste to everybody. I am the Ganesh. I am formerly the Minister for Environment, Science and Technology. Now I am working in the environment protections, all these pollution controls, and now I am the advisors to the Society of Environment Engineers in Nepal. We are also organizing an international conference on the solid waste management. With Dr. Navraj Khatibara will send you the details of our international conference. My yearly congratulations and all the best wishes to this international conference on the post-COVID waste management. Thank you very much.
Thank you. Then Ms. Suni Piapampong, President of Solid Waste Management Associate, Thailand, please.
Yes, good morning. I'm Suni Piapampong, President of Solid Waste Management Association, Thailand, also. SWAT is a non-profit organization established in 2015 with the aim to disseminate knowledge, improve waste management practices, and to create a network of waste management professionals in Thailand and other countries. I'm very pleased to join this ceremony. Thank you.
Thank you. Then let me invite Professor Pinjin He, Society for Solid Waste, Chinese Society for Environmental Science.
Excuse me, and I'm very happy to have chance to attend this meeting and listening the speaker's presentation and learn what we are doing during this very special, difficult time from different countries for the waste management sectors. And I think the virus is a global enemy. We need to unite together to fight, and we believe we can succeed finally. Thank you very much.
Thank you. Then Kosilatu, Director General, Secretariat of the Pacific Regional Environment Program, please.
Good morning, and good morning to you, everybody. On behalf of the Director General, Mr. Kosilatu, I'm Anthony Taloli, the Acting Director for Waste Management and Pollution Control Program here at SPREP. I'd like to thank you and the organizers for the invitation to be part of this event. As my colleague, Professor Frank Griffin has said, although the virus has not hit many of our Pacific islands, we appreciate the issues that are facing us with COVID-19 in terms of healthcare medical waste, and we are very pleased to be part of this event. and to be able, very pleased to be part of this event.
Thank you. Then final signers is Frank Griffin, Vice Chancellor, University of Papua New Guinea, please.
Thank you. I'm like Mr. Taloli on behalf of SPREP. I'm very, very privileged and excited to be part of these discussions. For us, it's more about learning from the work that has happened around the Asia Pacific region. As Mr. Taloli has said, the incidence of COVID-19, very few in the region. But having said that, it is not for us to sort of rest on our laurels. As Mr. Onogawa has said right at the beginning, it's on us to be proactive, to put in place the right type of frameworks, the right type of mechanisms to deal with this type of work. As we've seen over the last 20 or so years, we've had different types of viruses hit our countries. And as we have just had, it is a global enemy that requires a global approach, meaning that as the Asia Pacific region, whether it be working at the country level or at the regional, sub-regional level, we need to be united in moving forward in addressing this issue. So thank you so much for sharing your experiences. We have learned quite a lot. We will get this information and incorporate part of it into our own operations to help improve the systems that we work with. So thank you very much. God bless you all.
Thank you. Now we're going to declare the joint statement on society's contribution to sound waste management in response to the pandemic of COVID-19. So could you read out the joint statement in turns? So Yoshioka Sensei, please.
Yeah, the joint statement on the society's contribution to sound waste management in response to the pandemic of COVID-19. On the occasion of the 31st Annual Conference of Japan Society of Material Cycle and Waste Management, JSMCWM, we, the representative of the JSMCWM, Korean Society of Waste Management, Society of Environmental Engineers of Nepal, Solid Waste Management Association Thailand, Society for Solid Waste, Chinese Society for Environmental Sciences, and Secretariat of the Pacific Regional Environmental Programs, and the University of Papua New Guinea have participated online in the special international session on sound waste management in response to the pandemic of COVID-19 held in Sapporo, Japan on 18 September 2020.
Express our deepest. I'm Ganesh Saab from Nepal, advisor to the Society of Environmental Engineers Nepal. Express our deepest appreciation to the devoted work of those who are engaged in the waste treatment and related works under this pandemic of COVID-19 in recognition of their important role as one of the essential social infrastructure. Protest firmly against the unjust discrimination and prejudice to the people who are engaged in the waste treatment and related works under this pandemic situation, and seek enhancement of safety for those people and all society.
Thank you. Jaeyoung Lee, please.
Yeah, just a second, please. Yeah, it's recognized emerging problem and challenges under the pandemic, such as increase of plastic waste, infection waste, and household waste, lack of treatment capacity. Concerns about the improper treatment and increased pollution, advise the impact on the public health and the marine plastic pollution, and weakening of the recycling industry. Is that all? Oh, I'm reading continuously otherwise.
Yeah, and Pacific region, please.
Reaffirm the role of our societies and encourage members to promote related researches, evaluate the situation, develop technologies and systems, and give necessary advices on waste management and materials cycles in response to the pandemic of COVID-19 in order to maintain safe and reliable society.
Thailand.
Contribute for policy formulation towards sound management based on the knowledge of our societies, and restructure waste management and material cycle with and after COVID-19 for resilient and sustainable future, along with pursuing the Sustainable Development Goals, or SDGs, and Build Back Better. Promote sharing of knowledge and best practices and international cooperation and collaboration among societies and related organizations in the Asia-Pacific region on sound waste management in response to the pandemic.
Thank you. Now we're going to have a signing ceremony of the joint statement. So for signers, please go ahead, you're signing on a paper. And could you show your sign? Thank you very much. Now, oops, it's difficult to show you. Sorry. I collected 7 e-signs here. So you can see this after the ceremony. Thank you very much all.
Do I sign up here right now?
Yeah.
Yes.
Oh, really? And then show to everyone.
Yes, please. It's ceremony.
Yeah. Here.
Thank you, President.
Very nice.
Thank you very much.
Okay, Professor
Thank
Saka.
you. Thank you.
Nice to-
Congratulations.
Thank you very much. So now it's time for closing the symposium. So thank you very much, distinguished signers. So I would like to make brief closing remarks now. On behalf of the organizer of this symposium, I would like to express my sincere gratitude for all of you to join online this special international symposium on sound management in response to the pandemic of COVID-19. Also, I'd like to thank all distinguished presenters and signers of the joint statement for your participation, which leads to fruitful outcome of the symposium. Also, thank you very much, Professor Sakai, Professor Asari, and all members who have worked hard for realizing this symposium. So this is the first international conference on waste management in response to COVID-19 among societies of waste management in Asia and Pacific region. Today, we learn a lot about the situation and experience of each country of the impact of COVID-19 and measures to tackle those emerging problems and challenges. As we declare in the joint statement, based on our friendship, I truly hope that we continue to cooperate and collaborate among societies and related organizations for sound waste management, combating COVID-19, and sustain our society. Although we couldn't get together in Hokkaido this year, I hope to see you all in some time near future in person. So again, thank you very much and all the best for your further work. Thank you very much.
Thank you.
Thank you all, guys. Listen, we're going to expect next time in Korea, otherwise it's some countries. Oh, Professor Sakai, nice to meet you again. Hopefully, honestly, I really sorry about yesterday. I'm gonna it's out of town in right now, so I'm gonna sampling to some place. So I missed the yesterday symposium. Okay.
Okay, next time. Anyway.
Okay, next time. Okay, thanks.
See you.
Okay.
Bye
bye.
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 Okay, bye-bye to everyone.
Thank you
very much. Bye.
See you soon. Meet you soon. Thank you.
Thank you. See you. Bye-bye.
See you. Thank you.
Okay, thank you very much, everyone. Thank you very much, Soreno Sensei, Sakai Sensei, and all. So we will hold next meeting here. So see you later. Thank you very much for all audience and participants and panelists. Thank you.
You have a new announcement of some next of.
Okay, yeah.
Okay, very nice. Yeah. Okay. I just meeting. Okay.
Okay, so thank you very much, and see you in the near future. So we will upload today's video on YouTube, and also each presentation files on the website. We will inform you later to your emails. And also, this is advanced announcement about the next seminar with IGS and our society about waste to energy installation. So please check it. Please keep your schedule for the end of October. Thank you very much.
Yeah, excuse me. Would you send so this ceremony video to my society?
Of course, yes.
Yes.
Yeah.
Okay.
Yeah.
Thank you.
So you can immediately see on the YouTube. So thank you very much.
Okay. Thank you.
Okay, thank you very much for your organized.
Yeah.
Bye bye. すみません。じゃあ失礼します。高岡です。
And the big contribution.